Operation Eyesight has been in Ghana since 2009.
Operation Eyesight came because there were quite a lot of diseases, eye diseases in the country. Talk about cataract, talk about glaucoma, talk about trachoma, onchocerciasis, childhood blindness, refractive error, among others. And those are areas that they were already working with other partners in other countries. So their expertise were already there and they felt that they could help the country.
With Operation Eyesight, our main thing is to work as close with the government as possible. In most African countries, the government owns more than 70% of all the health facilities in the country. And that has helped us to develop sustainable programs.
The focus has been in terms of supporting Ghana Health Service to achieve their strategic objective.
The majority of people who need the service of eye care are not getting it because the human resource that we need.
Before we had this Ghana Blindness survey, we really hadn't done any survey, any baseline study on blindness in Ghana.
We didn't have the figures or the survey that tells us the burden of the conditions that we have. But Operation Eyesight came in and said, no, before we can even know what we are doing, we have to go to the field.
The need for data was paramount, but then Ghana was relying on WHO estimates.
So we realized that we had only about 2 or 3, not many eye indicators in the platform that actually generates data for the country. So Operation Eyesight Investor helped the country through IAPB, International Agency for Prevention of Blindness, to help us to develop new eye health indicators.
Operation Eyesight partnered with another NGO, the Swiss Red Cross, and then with the Ghana Health Service, the Ministry of Health, with the Ghana Statistical Services, with the Ghana College of Physicians and Surgeons, and together we actually did this study.
So Operation Eyesight led the first ever blindness and visual impairment so that we have the concrete data to help address the issue.
And so once the results came out, it was actually accepted by all. And I thought this was very, very good and typical example that we actually made this at a fraction of the cost it would have costed.
That gave us the data that we needed and also was able to help us measure the impact and then also look at the enormity of the situation at that time when it was launched. And it was so timely because data, as they say, is everything.
And from that study, we realized that 0.74% of the population are blind. In all, we had about almost 300,000 Ghanaians who are blind. And then we had 1.07% of the population having severe visual impairment. And so putting everything together, it was about 1.5 million people who actually have visual problems.
The blindness and visual impairment study has been the go-to document for the government itself and all other non-governmental organizations working as far as eye health is concerned to plan their programs, and it has also informed the development of the National Eye Health Policy.
So in that sense, they are adding on to the solutions that we are finding for people who have eye problems or who have other conditions related to eye in the country. So they've really supported the country to be able to offer all the necessary support that we can to our doctors and nurses in order to go to the community to help the people who are blind from cataract. And not only blind, but even those with severe visual impairment from cataract.
Per the last count, we have trained over 1,000 community health nurses in primary eye care, training for over 70 ophthalmic nurses, 21 optometrists in low vision, and we have helped in the construction of eye health units in a number of district hospitals, support the construction of Wartburg eye services, and we delivered eye health equipment across 35 district hospitals. We are looking forward to declaring more communities as avoidable blindness free to strengthen the existing eye care delivery system in Ghana so that the government or eye health system in Ghana can sustain itself and deliver quality, affordable and comprehensive eye care services for the population.
Operation Eyesight Universal is different compared to the other NGOs because it's more community-based. The communities that are among the least supported regions in the country where the burden of eye diseases are, and that is one thing I like about them, that they go to where the need really is.